I think one of the best things it does is creates efficiency in your whole workflow system. Just being able to save steps, to increase the turnaround time for the patient, making sure that you have that extra time to do those other things that you need to do in the pharmacy. We learned it in a day, so it wasn't really a big learning curve. Once you get used to the flow of the checkout process, it's very simple, and the screen actually walks you through most of it. We're doing about 50 to 55% of our drugs that we count. There are a lot of items that are single package size that we don't put in there, but with filling about 50 to 55% of it, it's an enormous burden taken off of us. It's created more efficiency. It allows them to do some of the other clerical tasks that they were not able to do before because they've saved time with the counting function on those 50 to 55% of our medications. It's taken a lot off of me knowing that I've got good inventory on those items that are in the ADS. It's increased the less demand on overtime for having staff here to do the things they need to do to get done in a week's period of time. Well, I don't think you really realize, if you don't have an ADS system, how many steps you take in a pharmacy retrieving and returning bottles to stock. Just the sheer number of bottles that pile up on the counter, it just allows you to have a clear process, saves you those step times, and increases the efficiency from point of entry to exit for the patient. We have had very few problems with reliability. Feel very confident in the number of tablets that are counted. We verify these, especially in the beginning. We verified many things that we're unsure about, but we found that it was actually more accurate than we were. So the ADS number one price point system was better than the other two systems we looked at. The efficiency, the noise factor was less with the RxMedic ADS versus the other systems we looked at. Plus the features that gave us with collate and capping, the label, just made it a real clear choice for us. I think that's a big component now of most workflow systems and error reduction methods, that you do visual verification. Generics change, so it always helps to just do a visual verification as well as checking the NDC and making sure it's the right drug for the right patient. Basically, restocking is the main one. We call it feeding it. And we eat 3 times a day, so we're here for 2 meals, so we feed it for 2 of those meals. Other than that, there's a weekly maintenance, refilling labels periodically, just very minimal productivity. It outworks everybody else in our store. No, I think we were all embracing the fact that it was going to give us more time and create a better work environment, and we really hadn't replaced anybody. Been here for 30 years. We service about 2,000 patients a month, fill about 300 prescriptions a day, and have had the RxMedic ADS system for over 2 years.